Hello, everyone. Welcome to all of you who are studying or want to study pharmacotherapy. Welcome to the Simple Pharmacotherapeutics Case and Quiz channel. Today, we will solve hypertension-related quizzes among cardiovascular drugs. The quiz we will solve today is an example of cardiovascular risk factors. Let's take a look at the quiz. To diagnose and evaluate hypertension, it is recommended to check for primary or secondary hypertension, identify risk factors for cardiovascular disease, and check for asymptomatic target organ damage and cardiovascular disease. Which of the following corresponds to a risk factor for cardiovascular disease? 1. Non-smoking 45-year-old woman. 2. A 40-year-old man whose father died of myocardial infarction at age 65. 3. A 43-year-old man with a body mass index of 24. 4. A 50-year-old woman with an LDL cholesterol level of 130. 5. A 53-year-old woman with a glycated hemoglobin of 6.6%. First, let's look at the risk factors for cardiovascular disease. You can refer to the pharmacotherapy textbook or the hypertension treatment guidelines. According to the hypertension treatment guidelines, there are 7 risk factors. 1. Age. 2. Family history of early cardiovascular disease. 3. Smoking. 4. Obesity. 5. Dyslipidemia. 6. Prediabetes. 7. Diabetes. In the case of age, it is 45 years or older for men and 55 years or older for women. This is because the risk of cardiovascular disease increases rapidly after menopause in women. A family history of early cardiovascular disease is when it occurs before the age of 55 for men and 65 for women. In the case of obesity, it is a BMI of 25 or higher. Dyslipidemia is a total cholesterol of 220 or higher. LDL of 150 or higher. HDL of less than 40 and TG of 200 or higher. Prediabetes is a fasting blood sugar of 100 or higher and less than 126. In the case of diabetes, it is a glycated hemoglobin of 6.5% or higher. Let's go over the quiz again. 1. Non-smoking is not applicable, and it is not applicable because she is a woman under 55 years old. 2. The father's cardiovascular disease occurred at age 55 or older, so it is not applicable, and it is not applicable because he is a man under 45 years old. 3. The BMI is less than 25, so it is not applicable, and it is not applicable because he is a man under 45 years old. 4. LDL cholesterol is less than 150, so it is not applicable, and it is not applicable because she is a woman under 55 years old. 5. HbA1c is 6.5% or higher, so it is a risk factor, but it is not applicable because she is a woman under 55 years old. Therefore, the answer is 5. The next quiz focuses on cardiovascular risk factors. A 62-year-old woman. The results after a recent health checkup are as follows. Blood pressure is 145/95, BMI 23, fasting blood sugar 120, glycated hemoglobin 6.2, LDL 130, HDL 45th. Her father died of myocardial infarction at age 60, and she does not smoke. To solve this problem, you need to know the cardiovascular risk factors, what the current blood pressure is, what the target blood pressure is, and what medication to start if you start medication. First, let's find out how many cardiovascular risk factors this patient has. She is a woman and is over 55 years old, so 1 risk factor. BMI is not 25 or higher, and fasting blood sugar is between 100 and 126, so it is prediabetes, so 1 more risk factor is added. Glycated hemoglobin is less than 6.5%, LDL cholesterol is less than 150, HDL is more than 40, there is no problem with family history, and smoking is not applicable. Therefore, this patient has 2 risk factors. Looking at the cardiovascular risk and treatment policy, this patient has stage 1 hypertension because her blood pressure is 145/95, and since she had 2 risk factors, medication therapy and lifestyle therapy are recommended in the cardiovascular risk and treatment policy table as a treatment method. It can be seen that this patient has moderate risk of cardiovascular risk because she has 2 risk factors and stage 1 hypertension. Looking at the algorithm on the screen, in the case of hypertension without complications, the target blood pressure for the moderate risk group is less than 140/90. And appropriate antihypertensive medications recommended primarily ARBs, ACE inhibitors, and diuretics. Then, let's look at the quiz again. Considering cardiovascular factors, what is not an appropriate treatment strategy for hypertension? 1. Lifestyle therapy is implemented for more than 6 months, and if the target blood pressure is not achieved, medication is started. In this patient's case, medication and lifestyle therapy should be combined, so it is wrong. Therefore, the answer to this quiz is 1. 2. The target blood pressure is 140/90 or less is correct. 3. Amlodipine is a calcium channel blocker, so it is correct. 4. Telmisartan is an angiotensin receptor blocker, so it is an appropriate treatment. Both 3 and 4 are appropriate prescriptions to achieve the target blood pressure, because the starting dose corresponds to the usual dose, so it is expected that the blood pressure will be lowered by about 10 millimeters of mercury after taking it. Today's tip. First, in the drug treatment of hypertension, you must remember the cardiovascular risk factors. Second, you must remember the number of cardiovascular risk factors and the target blood pressure by dividing the cardiovascular risk according to the patient's blood pressure. In the case of hypertension without complications, the target blood pressure should be less than 140/90, and the primary recommended blood pressure medications are calcium channel blockers, angiotensin receptor blockers, and diuretics.